You don't want to be waiting around at month 8 thinking, well, maybe I should see my doctor now. Like, if you're not getting a period, then you may not be getting ample amounts of hormones that protect your brain and your bones and your heart and your entire body. So it's not just, sometimes women are like, oh, it's so nice not to have a period. I'm like, I get that, and yet you really want these hormones. We don't want to be 30 feeling like we are postmenopausal with creaky joints, droopy skin, extra wrinkles. Nobody wants any of that.
Dr. Jolene Brighten, welcome to the Keto Camp podcast.
Thank you so much for having me. I'm really excited for this conversation today.
I am too. You are a leading authority in women's health. You're doing such great work out there, and your book, Beyond the Pill, is fantastic. And we're going to talk all about that. But before we do, I want to hear your story. Please share your story and what got you into the work that you're doing today.
Yeah, well, my story, I think like so many of ours, is just the twisty, windy road less traveled. Robert Frost, that's one of my favorite poems, is The Road Less Traveled. So I actually, very early on in life became sick as a child, a lot of digestive issues, struggled for a decade with doctors not being able to figure out what was going on with me. And it wasn't until the research on an organism called H. pylori made its way into clinical practice that my doctor decided to test me for it. And lo and behold, I had H. pylori. Now, this was after being through so many different tests, hospitalizations, and then doctors throwing up their hands and saying, well, we can't figure out what's going on, so she's probably making it up. And she probably has an eating disorder. And it became much of what now I've seen and heard so often from other women, which is doctors basically saying it's in your head. This is not a real thing. And so it turned out I did have H. pylori. Medicine just didn't know about this organism as a potential, I'm hesitant to say pathogen, but it caused gastritis in my stomach. So inflammation of my stomach, horrible heartburn and GERD. And at that point I got treated. Lots of antibiotics, and also was told I'd be on a proton pump inhibitor for life. And that was at 17. And I was like, I'm not going to take a pill every day for the rest of my life until they passed me birth control. Then I was like, oh, okay, I can control my body. But what I did then is I actually just started making observations about, how my diet was affecting my health. And my doctor said to me, I was like, well, what if I change my diet? And he's like, well, you can go ahead, but it's not going to do anything for your heartburn. Wait, so what I eat is not going to do anything to change my digestion. Like at 17, I was like, this doesn't make any sense. So that propelled me into studying nutrition. So at the time I was actually working in dentistry. I then went back to college, started studying nutrition. And I was actually on track to get my PhD. I was going to go to UC Davis and get my PhD in nutrition. And I came across naturopathic medicine. And for me, having gone, I had a chemistry degree, then a nutritional science degree, and here I was in my master's, I was going for my PhD, and I had a lot of science under my belt. But what I really liked about naturopathic medicine is how it asked why, and it never stopped. Even if you prescribe the drug, you still ask why. So if someone has high blood pressure, walking around with high blood pressure is not acceptable. We can't have that. Yeah, there are natural therapies that can really help, but we may very well need a pharmaceutical. But that doesn't mean just because you use a pharmaceutical that you stop trying to help that patient resolve what's going on or transition off that pharmaceutical. So when I found naturopathic medicine, it was a perfect fit for me in terms of, really what my philosophy was and how I looked at things. And it really integrated nutritional science. And so I went to naturopathic school. I thought, okay, I'm going to be a naturopathic doctor who focuses in gut health. Good thing I did, because that is everything. And that is very foundational to everything I do. People are always shocked. They're like, come in and they're like, just fix my hormones. I'm like, what's up with your gut? We've got to start there. And they're like, my gut? What's that going to do with my ovaries? We'll talk about it a lot. So, I went to naturopathic school and we were just chatting that Dr. Carrie Jones was actually a fertility instructor of mine while I was there. I had great mentors, and I had this epiphany while I was sitting in class one day where I was like, so much of my experience and other women's experience in women's health is that medicine is done to them. They are not a partner. They are just supposed to be a good girl that says, yes, please, thank you, and doesn't question authority at all. And even the gynecological exam and the pap smear was like, lay there, scoot forward, here's the speculum, like very mechanical. And what I was being taught was so different. It was consent. May I please insert the speculum? May I please, like, would you like to have a mirror to see what's going on? That was a whole paradigm shift. I never even knew medicine could be practiced that way in women's health. And that's when I really decided, okay, I want to practice women's medicine because I want to change this paradigm. I want women to question. I want women to have all the information they need to make the best decision for themselves. I want women to feel safe and confident and comfortable to say, no, thank you. This is not for me. I want a second opinion, or I'm, even within a gyne exam. No, I actually would prefer not to have a breast exam today. Can I defer that? Like, these are things that I didn't even know were possible from a patient perspective. And yet, really, I mean, the patient is in charge in terms of like their health and prevention and so many aspects. Now, mind you, don't misunderstand me, anyone. I am not talking about like if I'm in a car accident, I'm unconscious. Please, doctor, do whatever it takes to keep me alive. That's a different kind of scenario here. But that's really what propelled me into women's medicine. And I have to say that in all of this, the only reason that well, not the only reason, but a big reason why I've been able to pursue this career, have multiple degrees, be a first generation college student, is because I did have access to birth control. And so I spent 10 years on the pill. And when I came off, I developed what is now known as post-birth control syndrome. I had a lot of issues, and I had doctors, I went to a conventional in-network doctor who told me you probably had PCOS all along. And that's, this is just you, and this is your new normal. And I was like, this isn't normal. This isn't me. This is not how I remember me. And it was really in my experience, which I felt very alone in. I definitely struggled very silently with this. And then I went into clinical practice and found I wasn't alone. I wasn't the only one who had difficulty breaking up with birth control. And I began to get the reputation as the doctor who believed women's birth control stories, where women would schedule with me just by way of the fact that they had heard from a friend that I would believe their side effects, that they started birth control and now they're having side effects, and I wouldn't get mad at them for questioning it, and I would actually believe it. And that is something like still to this day, I just find so astounding. And to me, that was a huge alarm and wake up of like, when women come to ask birth control and question if it's right for them and question side effects and have their concerns, sometimes in medicine, we're meeting them with a muzzle and we're telling them, be quiet, just be grateful and thankful that you have access to this and don't question it because women before you had to fight so hard to have it. And yeah, we have had to fight to have it, but I don't think it's an either or conversation. I think it's yes, we want access to birth control, and yes, we want to know everything that could possibly happen to our bodies and what we can do to be safe on it, and what could happen when we transition off, so we can decide for ourselves and not have information withheld from us, which is, I think, I was just talking to a friend of mine this last week about she's a nurse, and I asked her, did you see in 2019 Medscape had put out this survey, and they surveyed doctors and they surveyed nurses and asked them, do you think it's okay to lie to a patient in order to get them to comply with the treatment that you're prescribing? And the number of physicians that said yes made my jaw drop. Like, the doctors self-reported they thought it was acceptable to lie to patients in order to get them to accept a medical treatment that they were possibly questioning. This is why we have nurses. The vast majority of nurses were like, no way. And I'm like, this is why we need a healthcare team and we need everyone together, because it may very well be a situation where that doctor's like, I've got 3 minutes to get you to make up your mind. So I'm going to tell you what I think you need to hear because I want to save your life. Whereas the nurse may be coming from a different place of like, well, I've got more time to spend with you to help educate you, to help you make that decision. And really, I think that everyone in healthcare, whether it be patients or healthcare providers, all want more time to do a better job. And everyone is very much invested in doing a good job. So please, nobody take this as like, oh, your doctor is just a terrible person. They're not. There's some upstream issues in how a lot of us get trained.
Yeah, I love your story because you were somebody who thought outside the box right from the beginning when you were 17 years old, and you're like, wait a minute, that doesn't sound right to you. And that's not normal, Dr. Brighten. That's actually uncommon. And I love that's the way you think, and that's the way you empower other people. So now you have a book called Beyond the Pill, and you have a lot of research on the birth control pill. Out of all the things you could have focused on, right? When it comes to women's health. Why did you choose this specific niche?
What other book out there exists that takes a deep dive on birth control like this? It didn't exist. And so really that was a big part of it. I'm like, there's all these really great hormones books and women's health books, but they might have like a little box and a mention of birth control. And yet we're seeing that over a quarter of women are using hormonal birth control. And this was something I was seeing in my practice day in and day out. I didn't understand how my body worked, and I didn't understand how birth control worked until I went to medical school. And that's not right. Women shouldn't have to go to medical school to understand the body that they live in. And so really Beyond the Pill is born out of my clinical practice. It was the patients who chose me, who trusted in me. And I just documented what was happening. The protocols you find in Beyond the Pill, they're straight out of my chart notes. Like there was parts of writing that book where I was like copying and pasting out of chart notes, the treatment plan, because I'm like, this is the thing that we found time and time again. As the book was coming together, what was really interesting is that I was like, women need to do a 21-day. We need to spend like 3 weeks really working on their detox system and supporting their liver and supporting their body. And then I had patients who were quitting after 2 weeks and getting results. And I was like, let's try 14 days. Let's try 14 days with people. And it was working really well. And I'm like, okay, so some people need to like spend that extra week, but okay, but the majority I'm seeing, they can spend 2 weeks. So that's really, for everybody who's ever written a book, you will know when I say this, you only write a book if you can't not write that book. Because writing a book, there's people all the time that I will share about my book and they're like, well, you're just saying that because you're trying to make money off your book. And I'm like, I'm not J.K. Rowling. Authors, health authors we don't make money off of our books typically. That's just like not the way it works. And when you do, it's like $1. Like, let's be real, like this would be very transparent and real. But everything that you put into this book, what I put into it was really because it's the manual I wish I had to go through my reproductive years. And I'm still in them, but I would have liked to have this book when I got my period and I had debilitating cramps and I bled for more than 7 days and I missed school and I was vomiting and I thought that was normal. But instead, and then I ended up going on the pill for that. When instead I could have made a dietary shift to include more omega-3 fatty acids, magnesium, vitamin E, things that actually regulate prostaglandins. But just for 3 years, I struggled and I hated my body and I hated my life thinking that this is just the way it is. And when I went on birth control, I wish that anyone had told me how it actually worked. I had no idea. I wish that I would have known what side effects to look out for. I wish I would have known why my gut symptoms started getting a whole lot worse, why I had joint issues, why I lost my libido. I didn't know any of this. I just kept going through my 20s thinking I'm old and I'm broken and this is what it's like to get older. Like that is not what it's like to get like older. That's in your 20s. Like, what are you even thinking? So, really so much of this book is about wanting to educate women to help put the medicine in their hands. We need big change in women's medicine. It's not going to happen. It's not going to happen because of me going out and saying we need to make this change. It's going to happen when every single woman is taking ownership of her body, taking back her hormones, and showing doctors what could be done. Because doctors, depending on how you're trained, are being taught that nutrition does nothing, that, food is not medicine. Like, that's crazy talk. I'm like, but like literally what you eat becomes every cell of your body if it's absorbed. So like, what? Like, this doesn't make sense to me. So I really wanted to help women where they're at, be able to own their body, understand their body, and then partner with their doctor and be more educated in that so that they can get more out of that doctor's visit and get the help they need.
I love it. Yeah, you're providing them the information and the freedom to choose their path and understand their body. So I respect that so much. I want to know, what are some of the issues that the pill can cause that are not commonly spoken about?
Yeah. So, well, everybody like seems to know that low libido can happen. They just don't know it can happen to them. So there's the low libido piece, which women joke all the time that that's actually how birth control works, is that you don't want to have sex, so you're not going to get pregnant. So there's that component. But what's really not talked about, we hear a lot about like, well, what are the cancer risks? What are the cancer benefits? What about stroke, heart attack? But, we don't go into the diabetes conversation as much, that it can, in some women, cause insulin issues. And in fact, we've seen studies that are showing that if you were on birth control for 6 months or more, and then you enter into menopause later in life, you're about 35% more likely to develop diabetes, because birth control is inflammatory. Also something that we don't talk about. And understand that for everybody listening, always view everything through the lens of what's true for you, because we don't have great studies to know why one woman gets on birth control and her mood symptoms, her depression, her anxiety, her PMS, PMDD, gone. Another woman gets on birth control, and now not only is she depressed, but she's having suicidal ideation. She's thinking about taking her own life. Like, we don't know why her and not her. We don't understand that. What we do understand is that there are receptors for your hormones in every single system of your body, which means that your natural hormones and the synthetic ones found in birth control can interact with every single system in your body. And it may very well be your genetics married with what's going on in your environment of how you might express side effects. So when it comes to like the clot risk, we're told often that like the risk is very, very low, don't worry about it. But if you have specific genetic factors like a factor V Leiden mutation, it's different for you. That's different for you. And we have to start understanding this as a population as a whole, is that studies don't tell us everything about everyone. Studies have, okay, here's what we saw in the majority of people, here's what's statistically significant. And they don't often say, and here's all these weird outliers, we don't know what's going on about that. You may be an outlier, and that doesn't mean something's wrong with you. And it doesn't mean that it doesn't mean that you should ignore it either. It just means that you are an outlier and things have to be viewed differently for you. So one instance of this is that we know if you have a family history of autoimmunity, so like interstitial cystitis is linked with hormonal birth control, as is Crohn's disease. So there was a study that came out of Harvard showing that if you had a family history of Crohn's disease, after 5 years on the pill, you were at a 300% increased risk of developing Crohn's disease. So for you, that there's going to be a different expression. So you might start having gas, bloating, you might have some diarrhea, or maybe even some constipation within years of starting birth control, which then over time may become Crohn's disease, where now we have bloody stools, or we're having malabsorption issues, or it may start with ulcers in the mouth, which people often are like, I ask about this all the time with my patients, especially those on birth control. And I've had patients that are like, yeah, I get ulcers in my mouth. I'm like, okay, have we talked to a dentist about it? And also we should get some testing done and just make sure. And sometimes we do find markers where, okay, it's looking like you might be developing Crohn's disease. Let's get you over to a gastroenterologist and figure out what's going on. Now, the other issues with birth control, I mentioned the mood. There is a correlation between starting hormonal birth control and and developing depression, being diagnosed with it, and being prescribed antidepressants. At this point, we don't have any causation studies, and we may never have causation studies, because it is very hard to do a study that, yes, in fact, birth control directly caused your mood issues. Because again, birth control is interacting in a lot of ways. So one is that it's stimulating receptors in the brain. Two is it's inflammatory. We know that inflammation can change our mood. It's altering gut function. We know that your gut can dictate how your mood is as well. And then it can create nutrient deficiencies in some women. So things like magnesium, B vitamins, zinc, selenium, antioxidants. So it's all these kinds of things that often aren't talked about. And when I start talking about them, especially when I'm lecturing to clinicians, and this is what doctors do, and they should, they're like, what are the studies? And then when I start going through the studies and they start seeing that there's been studies since the 1970s talking about nutrient deficiencies, and that it's so well recognized, a pharmaceutical company developed a pill with folic acid in it to try to safeguard against that, because spoiler, it's not 99% effective with how most women use it. It's 91% effective, which is to say 9 out of 100 women on the pill will get pregnant in a year. So there is no 100% surefire way to avoid pregnancy other than abstinence. And that's not realistic for most people.
Yeah, that's super interesting. I want to go back to what you said about the diabetes. So I gave a talk recently at Low Carb USA, and I was talking about the role that toxins can play with type 2 diabetes, and how they could actually create cellular inflammation on the receptor sites, which would make insulin having a harder a job of bringing glucose into the cells. Is it something similar to that?
That's what I think is going on, is that we've got that. So, and this is why we can see other hormones become an issue while on birth control too, is because when the cells get inflamed, they become rigid, and docking hormones onto the receptors doesn't work as well. So it doesn't matter. And this is where your doctor might measure your blood work and say, well, everything looks normal, but you don't feel normal. And then we look at like a CRP, for example, a marker of inflammation, and it's like 8. Okay. You're super inflamed. I mean, even when we get above 1, some people start to have issues, and certainly above 3 can be an issue. And so it can be that, yeah, your hormones look fine. We just got to get your cells to use those. So there's that piece. And then there is the piece as well that our hormones do interact. So estrogen and progesterone interact with insulin, that estrogen and progestin in hormonal birth control can as well. And it can be that, you'll hear often where people will say, like, you're in a suspended luteal phase, so the suspended second half of your cycle while on birth control. And that's a place where we become a little less sensitive to insulin, which is also why, if anyone is listening, this can be part of why, leading up to your period, you're like, I want to eat everything. And it
Yeah.
can be about that blood sugar component and what's going on with your hormones. But does that make sense?
Yeah, it makes a lot of sense. I'm glad you cleared that up. Thank you. So we talked about those who are on the birth control pill. Let's say somebody just got off, like you got off the pill and you started to get those symptoms. What are some common symptoms that happen? And then what are some things that they can do to alleviate that and heal the body as they get off the birth control pill?
So again, every single system in the body is up for grabs because they all have receptors. Now, when it comes to hormonal transitions, we as a society don't have any problem acknowledging that getting your period for the first time is a big hormonal shift. So going through puberty, I think we all know. Now Netflix has like that great series, Big Mouth, with the hormone monsters.
Oh, yeah.
She's
hilarious.
My friends are always like, you're totally the hormone monstress. I'm like, well, but I do shower. So there's that. So, with that in mind, though, we recognize that these are big shifts. Having a baby is a big shift. Giving birth is a big shift. So like, that's a huge hormonal shift, going through menopause. But for some reason, we can't wrap our heads around the idea that you flood yourself with synthetic hormones to stop your brain from working. So it stops your brain from talking to your ovaries. It doesn't stop your brain from working altogether. Just want to be really clear. Just stops brain ovarian communication. And then you come off. And like, that's not supposed to be difficult. Like, that's not supposed to be a big transition. It's a big hormonal transition to make. So for some women, they can lose their period for 3 to 6 months coming off of birth control. If you had regular, predictable periods before starting, it should come back within 3 months. If it doesn't, you definitely need to see your doctor. If they were irregular, unpredictable, 26 days, 46 days, I don't know, when's it been here and last, we expect that it'll take about 6 months for it to come back. But I still say, go see your doctor and get worked up at 3 months, because you don't want to be waiting around at month 8 thinking, well, maybe I should see my doctor now. Like, if you're not getting a period, then you may not be getting ample amounts of hormones that protect your brain and your bones and your heart and your entire body. So it's not just, sometimes women are like, oh, it's so nice not to have a period. I'm like, I get that. And yet you really want these hormones. We don't want to be 30 feeling like we are postmenopausal with creaky joints, droopy skin, extra wrinkles. Nobody wants any of that. So in coming off of hormonal birth control, we've got the period component, but other systems can be impacted as well. So we can see new onset of neurological symptoms like brain fog, anxiety, depression, headaches, migraines. If that's the case for you, really, and everything I say, definitely work with a practitioner so that you can navigate this best. But it may be something that, like, okay, you're having these abrupt hormonal shifts. We need to work on your hormonal system. So in Beyond the Pill, I take you through not just sex hormones, but all of your hormones. And I actually have a whole quiz in there to help you get dialed in on your hormone imbalance so you can be really targeted. So you take the quiz, we go right into nutrition, lifestyle practices, and then there's tables for supplements as well, which gives you several options. And this has been coming up lately where women are like, I don't want to take folic acid. I've heard not to take folic acid. All the supplements, I mentioned several different companies in my books. They don't have any folic acid in them. So just so you guys know. I'm like, I should have written that somewhere, but I didn't see that coming, that being something that was going to come up. So
I love that they knew to ask you that, though. That's a great question.
yeah, it really is a great question. It's been coming up more recently because I was talking about prenatals and folic acid and folate, and it's just so everybody's on the same page as us. There's a genetic variant called MTHFR, which makes it so that you don't utilize folic acid, and this is involved in your folate metabolism and really, really important for your health overall. Now, just because you have MTHFR doesn't mean that you have to go get on folate. You might be doing it with your diet. You might be fine eating all your leafy greens. But if you do use prenatal or multivitamin, then you want to be using something with folate, because especially if it's a prenatal and you're looking to conceive, you need to have folate. That's going to help you be healthy, and it's going to help baby be healthy as well. So when coming off of hormonal birth control, we talked about the period issues. There can be some neurological issues coming up. We might have digestive issues. And in my book, I walk through all of these systems. Now, something that I alluded to earlier is supporting your detox pathway when you come off of birth control. So I titled a chapter of my book, Birth Control Hormone Detox 101, with the thought that my thought on this title was that this is going to teach women how your body detoxifies birth control and detoxifies your hormones. Like, your body does this. And yet now we've seen companies coming out with like all kinds of products and all kinds of things, and people saying like, you cannot detoxify birth control unless you like do all these supplements and these protocols. And I'm like, that's not what that chapter was saying. And I don't know if they were inspired by that chapter, but people have come back and said, well, it's because you said birth control hormone detox 101. I'm like, it's 101 of how your body detoxes hormones. So your body is always detoxifying every single day. It's what it does. It does it really well. But on hormonal birth control, if you are experiencing nutrient depletions, so B vitamins, just by way of example, that can impact your liver detoxification pathways. In addition to that, your liver so when you take the pill, your body breaks down and metabolizes some of it. So it's going to absorb some of it, and then that's going to pass through the liver, but it's still a high enough dose that even after going through the liver, it's enough to shut down brain ovarian communication. And then, it can alter the microbiome, because the rest of that travels down to the large intestine, and we don't actually know what those organisms do with those hormones and the different metabolites that they're creating. So with that, we need to be supporting the liver. Older formulations of birth control did lead to liver tumors. Some women still get liver tumors. These are not cancerous, they're benign liver tumors, but it does also mean there's structural change to your liver, and there can be a genetic change to your liver. So this comes back to epigenetics. When you take hormonal birth control, that's, an environmental signal that comes in, tells your liver, upregulates sex hormone binding globulin. And so as it does that, you're going to be grabbing onto your hormones, a very good thing to keep you safe, not so good because this can be part of why you lose your libido. But also, we don't know what else could be going on and what other changes could be happening. We understand that for some women, they'll have higher cholesterol. Well, often people are like, oh, well, if you have high cholesterol, that's because of your diet. It's because of your liver. Like, your liver is making this cholesterol. So we have to be looking at how can we support liver health, gut health, adrenal, thyroid, metabolic health. And, so much of this is going to be getting great sleep, not just going to bed. Getting great sleep. You need your deep sleep. I'm wearing my Oura ring right now.
Yeah, me too.
Always tracking that. I know. Do you dictate your day? If you get up and you see that your readiness score is really low or you didn't sleep well, do you change your day?
Yeah, I mean, in a sense, yeah. If I see I have a good readiness score and I check my deep sleep and REM and I'm like, I'm ready to rock it today, I'll go crush my workout. So yeah, I do have that extra motivation to do so. Yeah.
I've also found there was about a month ago that I was getting ready to travel, and I woke up and my readiness score was really low, and I hadn't slept well, and I was like, what is going on? Like, why? I don't know why, but I had a flight. I am usually the person who walks in the airport, walks through TSA, walks to the gate, walks right onto the plane. Like, I am so last minute, and it drives my husband nuts. I saw my readiness score was super low, and I'm like, I'm going to get to the airport an hour and a half early. I'm going to take my time. Good thing, because it was actually ended up being a really stressful flight. And I'm like, wow, like that was a really good call. So I will say, like, this is where I love like tracking this data, because you can make these little shifts. Like when you see these things of like, okay, my capacity to handle stress is lower today. What can I modify so that, and why you want to modify this for everyone listening. If you're like, I don't want to be extra. Yes, you do. Because in modifying that behavior, that made it so that my cortisol was less likely to be spiking along with my epinephrine, norepinephrine. I already know my genetics and know I have a harder time clearing catecholamines. So once I'm up for a while. So I modified that behavior. By the time I got to my destination, I had to be speaking on a stage 2 days later. I knew what my readiness score was before. I made sure I got extra sleep. I wore my amber glasses religiously. There was all these things that I did that made it so that my next period, easy. My energy levels, great. Like, but I could have went about it a different way, and I could have totally crashed my system and been sick probably 2 weeks later. And so I think it's really awesome to be extra some days when your body needs it and give yourself permission for that. And that's something that when you come off of birth control, you may very well need as well, is to say like, and I actually talk about in my book, like when we talk about like detoxifying, people are always like, okay, what do I need to like eat and take in? And it's first like, what do I need to stop taking in? How do I need to help my system bring things out? And also, who's in my life? Because people in your life and relationships can be significant stressors as well. And this is something I counsel patients with, of like, look, if you've got like a coworker that just rags on you, and then like you're always going out with them after work and it doesn't make you happy, and you're in a healing phase, you need to pause from that. Like you need to just say no, don't go out with them, find something else, find a hobby, find a book, like do something else. And it doesn't mean you have to ditch people forever, but it does mean that you need to really safeguard your own energy and your own health as you're healing.
That's such an important point, because a lot of people don't realize that our environment dictates what's happening. We become our environment. If you hang around dogs, you're going to get fleas type of thing.
Yeah.
So Bruce Lipton has research on
I
what.
was like, but I love dogs.
Well, that's not my dog's sleeping
I
right
know, I'm
here.
just
You know
kidding.
what I mean.
I know
Uh,
mine was just trying to get in. He's like, hi.
yeah, mine is like just sleeping. A 75-pound German Shepherd lab right underneath my desk here.
Six
Um,
pound Chihuahua over here.
oh yeah, big difference.
Yeah, I've always had pit bulls, so this has been a really. I always say, I'm like, you're more ferret than you are dog. Like,
I had a pit bull too. They're such clowns, aren't they?
I love, oh man, my two pit bulls, I love them. And they are, yes, they are clowns. They are, when I tell people they are the most emotional creatures, like they really are. And my girl dog, she always wanted to dress up, and she wouldn't go out in the rain without like a coat. Like these, like people are like, oh, pit bulls, they're so like, people have the things they say about them. And I'm like, you don't even know. They're such babies. They're such babies. And then the 6-pound Chihuahua, he's got like way more like attitude. We were traveling recently, and he like tried to take on probably like a 30-pound iguana because it got too close to my kid. And he was like, no, stay away from my kid. I'm like, man, little dogs' brains, I guess, are just not big enough to know better, or they're really, really loyal and fierce.
Yeah, that's amazing. A little bodyguard you have there.
Yeah.
Well, I wanted to say that you're talking about our association and the negative thoughts that we may be thinking or people might be
Mm-hmm.
projecting on us. Well, Bruce Lipton has shown that that could actually create inflammation around our cells. And when
Yeah.
we have cellular inflammation, then we can't detox. The good stuff, the bad stuff can't get out, and we can't produce enough of the good stuff. And then all of a sudden, detoxification is starting to fail. So I
Mm-hmm.
love that you have that component in there. And your book, before we move on here, where is the best place to get your book?
Oh, you can get it at a bookstore, on Amazon, anywhere that they sell books. And I do want to say there was a study where, so everybody touts meditation, right? And everyone's like, meditation is the best thing that you could do. And it is a really good thing to do. Yet they did a study and they looked at inflammatory proteins. And what they found was saying nice things to yourself beat meditation when it came to inflammatory proteins and health outcomes. So if you don't have time to meditate, or you're someone who's like, meditation's not for me, get in front of the mirror and compliment yourself. And when you catch yourself with negative self-talk, stop it. It's inflammatory. And if you're not going to do it for you, do it like, do it for your health. Do it for the people in your life, that you are kind to yourself.
Such great advice. Yeah, that I teach that. I teach my clients because I learned this from Abraham Hicks to look in the mirror, say thank you, I love you, and say that 5 to 10 times a day.
How
And
was it the first time you did it?
it was so weird and strange, and it was like,
It's kind of hard, right?
yeah,
And like, you don't want to make eye contact with yourself.
yep.
Like, you don't want to make eye contact with yourself and say that, but yet you would say it to, you know, someone else in your life. So I just wanted to ask that because I think sometimes we say these things like they're going to be really easy things to do. And then people go and do them and they're like, what's wrong with me? Why does this feel so difficult? Well, because we're not like, we're taught a lot of US history in school, but we're not taught a lot of like self-love, self-care, self-compassion, nutrition, balancing checkbooks, these things that
Any
we
of
need
that
as
pretty much.
actual life skills.
Yeah, totally. Yeah, I'm a big believer in self-love for ourselves and then for other people as well. So I'm walking throughout my day, I'm brushing my teeth, and I'm saying I love myself, I love myself. It's these
Hmm.
affirmations that heal the body. On the opposite side, two of the biggest destroyers are hatefulness and resentfulness. So
Hmm.
I love that we're talking about this. So what I teach is a healthy cyclical keto. So I call it keto flexing, and
Hmm.
I have different variations in how I teach it. Like for instance, female clients I work with who are cycling, they have their monthly period. I have them get out of ketosis 7 days before their period to have high healthy carbs and have specific carbs that help stimulate insulin that help these hormonal conversions for the monthly cycle. Also, don't have them fast. So the reason I'm bringing this up is there's such variations out there. There's no cookie cutter approach. We are such unique people with our epigenetics and what's going to happen in the body. So when people think of keto, they think of one way to do it when it's not really one way to do it. But my question to you, and the reason I'm bringing this up is, how important is it to get quality saturated fats and cholesterol in the body for hormonal health?
Hmm. Well, firstly, I want to say, really so appreciate that you respect that women are cyclical creatures, because so much of the keto world, there's a disconnect. All this research has been done on men, and then they're trying to apply it to women, and then women are getting frustrated and being like, why can't I keep up with my male counterparts? Well, your male counterparts don't actually grow a human in their body and then go on to feed that human. Like, we're very different, and it's almost like acknowledging differences is an invitation for someone to say, like, who's the weaker sex? There's no weaker sex. Like, we're compatible. Like, we're meant to go together to support each other. Like, and it's just, yeah, it's a silly thing. I think it's to even go there, but to say that women are very much different. And when it comes to cholesterol and saturated fat, these are healthy components of the diet. Now, your liver makes cholesterol, and cholesterol is how we make hormones, but we still do well to take in dietary cholesterol. And if you look at places where we get dietary cholesterol, they're usually very nutrient dense. So where are you going to get your fat soluble nutrients from? That's going to be coming from eating these fats. And we don't, you know, we want a variety of what Mama Nature made, not a variety of what chemists made. And that is from the gal who grew up on margarine. Okay. So that's that big old tub of margarine in my fridge as a kid.
Same here.
Yeah, because we thought better living through chemistry, and yet the more and more time goes on, research comes out, people are living on this planet, we're seeing that, like, actually, Mama Nature never got it wrong, but humans have gotten it wrong plenty, and especially when we think we can make superior foods that are made in a lab. It doesn't make sense. Although I used to think that it did. So if you are someone who's like, wait, hold up, having trouble with that, like, I've been there in that paradigm shift. So with this, saturated fat is important, and it is part of our cellular makeup. So our cells have a phospholipid bilayer. This is how we keep what we need in and what we need out. And the idea, like, this was the other thing. I'm on birth control. I'm losing my libido. I'm not feeling awesome. I am definitely over exercising, and I'm eating a fat-free vegetarian diet. Like, is like, I didn't want to have a libido. Like, the fat-free part is like the worst thing that you could do to your hormones. And yet we were taught, like, oh, fat is so bad. And I really reject this language that people use of like vilifying foods or categories and saying that's bad, that's bad. When I say that, I'm talking about legit food. I'm not talking about like a bag of highly processed, whatever, sugar things. Like that's not really food. Like that's just like some dye and some cornstarch and stuff. Like that's not the same. So I'm talking about actual food. There is no bad food. There's just what works for you and what doesn't work for you. And how do you feel when you're on it? Do you feel awesome when you eat this or when you don't eat this? So but yeah, fat is a really, really important part of our diet, and vitamin A, E, K, that's how you're going to get that, is through those healthy fats. And especially when it comes to things like, so when we're talking about birth control or women's health altogether, especially like women struggling with like acne, immune issues, like we look at something like chicken skin and getting that fatty layer that's in there that's rich in vitamin A. So are egg yolks. So I think that, one, if people are afraid of fat, there's no reason to be afraid, but I really doubt anyone in your camp is, because it's a keto camp.
That's correct.
And I think that, you know, we really have to be cautious. Anytime I hear someone saying, you know, just vilifying a whole category or food group or things like that, it's something where I've been in, you know, nutrition and health for over 20 years now. And I'm like, that's just the new trend. Like, that's just the new trend to vilify that. And it's really not the case. And the other piece that I'll say about women's hormones and fats, and I talk about this in Beyond the Pill, is how important omega-3 fatty acids are. So the Western diet tends to be skewed towards higher omega-6. That's a great way to have horrific menstrual cramps, because we make prostaglandins, hormone-like chemicals, hormone-like substances, from these omega-3s or omega-6s. Omega-6s will make really potent ones. This is how our uterus contracts, but also it'll contract your bowels as well. So this is where you can have really painful cramps and period diarrhea. And this is also how we birth babies. So prostaglandins aren't bad, but if you're having really bad cramps, we want to be looking towards more omega-3 fatty acids and bringing those in. Now, you know, if like, I don't think like your audience is going to be a lot of vegans, but for people who are vegans and vegetarians, I talk about this in the book, that we actually require our own natural estrogen to convert what is found in the environment, those omega-3s, into EPA and DHA. Now, that requires our natural estrogen, but if you're on hormonal birth control, you don't have natural estrogen. We don't totally know. Do you make that conversion? And you're really inefficient at that conversion as it is. So this may be a situation where, you know, I have patients who are vegans and vegetarians. Their omega-3s are not looking good. They can't get them from plants. They can't get them up, and they don't want to go the route of eating any fish or, you know, that's primarily where you're going to get it, is like sardines, mackerel, salmon. And so they might elect for trying algae, and sometimes that works, and sometimes they go for a high quality fish oil. Omega-3s are really, really important fats to have in the diet as well.
Awesome. Great advice. So we're wrapping up here, and I have my rapid fire questions for you. Are you ready to rock these out with me?
Yeah, I just drank some coffee. I think so.
Yeah, you're ready. You're ready. Okay, here's the first one. What is your favorite keto food?
Avocado.
Mm-hmm. What about your favorite
That's a lie. It's probably eggs.
Oh, eggs with the yolk, not chicken without. So chicken breast and egg whites, we're not talking about that. We're talking about chicken with the skin and egg.
No,
yolks.
I have my own chicken, so it's all about the yolks.
Oh, yes. That's awesome. It's probably orange and delicious. Favorite non-keto food?
Wow. Maybe I would say potato, like a white potato, like French fries or tater tots.
Awesome. What's the first thing you think of in the morning?
Usually, how good is my sleep?
Check the Oura ring.
I do. It's become a little bit where I'm like having to check myself, where I'm like, is this a good habit? But my son has like some health issues, and he's 7. He usually goes to bed at 7. He was up till 11 last night. So that was first thing this morning. I was like, what does my app say? How did I sleep last night?
What was it? Let's compare our stats.
Well, let me see. I think it was in the 80s, which wasn't too bad.
Let's see who won today.
Who won?
So I got an 83 sleep score and an 82 readiness score.
I got an 80 readiness score and an 84 sleep score.
Okay.
85.
Oh.
That's weird. It just updated. And for everybody listening, today's the first day of my period. And this is like, we're going TMI, but that's the way it is, which means that last night should have been the worst night of sleep for me, because my estrogen and progesterone were dropping. And that's usually when women will have difficulty staying asleep, falling asleep, have, disrupted sleep. You can even have have like mild hot flashes. And yet my deep sleep was over an hour and my REM sleep was over 2 hours.
That's
So
great.
it's
That's really
possible,
good.
guys.
Yeah. Your
I
body
actually have been working on that and tracking that for a couple of months. And I'm like, I need to get that like at that one last day. I'm like, let's get it dialed in.
That's so interesting. Does your body temperature also go up right before your period?
Your body temperature actually spikes just mildly before ovulation and with ovulation. But what happens is that so we all recognize like, okay, in perimenopause, women can be having hot flashes. And that can be spikes and drops in estrogen. So you're making estrogen and then it drops abruptly and then you have a hot flash. And then this can happen as well in our 20s and 30s, that if we've got higher amounts of estrogen and then it drops before our period, we could feel a little more hot at night. We can have like feel sweaty and feel like we're having a hot flash. But it can also happen because of your adrenal hormones. So this is where it's really important as you talk about fasting. If patients say to me, oh, I'm fasting, but on the night, like when I do a fast at night, I'm actually waking up and having a hot flash. And I'm like, are you waking up hot? Are you feeling a little bit anxious? Is your heart racing a bit? Yeah. Yeah, that is actually your adrenal glands firing off hormones to liberate blood sugar because your blood sugar is dropping too low. And it may not be that like, oh, you just can't fast. It may be where you're at in your cycle. So like you were saying, as you get to that, closer to your period in that end of the luteal phase, you have women eating more carbs, and that's a good idea because that insulin sensitization can be changing, and that's a time where we'd be more prone to blood sugar instability. And it doesn't mean like, oh, you're just like metabolically unstable all the time, but during that window when you're cycling, that's where we can see that. So I hope that helps some people differentiate between, is it a hot flash because of estrogen or is it a hot flash because of catecholamines and stress hormones? And if you have a hot flash every time you go to like give a presentation or it's a stressful event, it's unlikely estrogen, much more likely that it's your adrenal hormones.
Oh, great information. Okay, we have less than 5 minutes to go. I want to get through these
Okay.
rapid fire.
Oh, we have more.
Yeah, I have more for you.
Okay.
What is the best piece of advice you've ever heard?
You're the only one living in your body, and you're the only one who knows what normal is. And so always, always advocate for yourself. And if something doesn't feel normal for you, make sure that you say something to a different provider, get a second opinion, and keep advocating for yourself.
Amen. What's the worst piece of advice you've ever had?
Oh, that your symptoms are just in your head, and it's normal for a woman to be in excruciating pain once a month and miss school and miss work, and you should just accept it, or you should just take birth control and suppress your body.
What was your favorite TV show growing up?
I didn't grow up with a TV.
That's awesome.
I still don't own a TV.
I love
that. I'm like going to be 40 in a few years, and I'm like, I've never owned an actual TV.
That's why you're so productive. I love that. If you had one superpower, what would it be?
Oh man, that is like so hard. I don't know. Sometimes I'm like flying because I fly a lot, but could I be just Jean Grey? I mean,
yeah,
she's got like everything, right?
That'll work. Who do you admire most? Maybe it's this.
Oh.
Yeah.
I don't know. Of a single person that I admire most. There's so many people.
Like who came to mind first when I said that?
I'm going to be really like honest with you. And Kobe Bryant, because of his recent passing, and really, so you guys, as we're talking right now, he just passed away like 2 days ago.
Yeah.
And I was actually on an Instagram Live when I found out, and people were telling me, but I didn't know anything about Kobe Bryant. I don't know anything about sports, guys. Don't ask me. I mess him up all the time. But I was actually going to be on Jordan Harbinger's podcast. And I was like, oh, I want to listen to some of his guests and his interview style. And I listened to an interview with Kobe Bryant. And I was like, wow, so much of what he said really resonated with me as a woman, as a mother, as just a business owner. I mean, just in so many ways. And that, he always came about things like he got hated on a lot because he didn't go out drinking, he didn't party, he didn't do all that because he was like, I am going to be the best. And whatever I do, I'm going to be the best at it. And I'm going to get there by putting all of me into it and being really, really dedicated. And that was so admirable. But I do want to acknowledge that in saying that is that there are a lot of women right now feeling triggered by seeing his image and his words, and even me speaking about him right now, women with this history of sexual assault. And I think we can't ignore that piece as well, which is why I was a little cautious bringing his name up, because it is, you know, grief, respect, like all these feelings. I mean, there's a lot swirling. It's a very complicated situation right now, but that was the person who honestly came to my mind because of recent events.
Yeah, well said. I read a book about him called Showboat probably 3 or 4 years ago, and it was about his whole story and his mindset just for achieving success, and it made a
Hmm.
big difference in my life. Such a tragedy. Two more questions, and then we're done here. The next question is, what is your favorite hobby?
Gardening. I love
Uh,
growing food.
I love
And
it.
I do it all organic. So as much, it can be very frustrating at times, but yeah, at other times it's very, very rewarding. But my yard is, I grow the majority of our food during growing season. And then my yard is filled with medicinal plants. So my friends always joke, if it's ever the apocalypse, go to Jolene's house because she's got like all the herbs.
That's awesome. So speaking of that, the final question here is, what is the strangest food you've ever eaten?
Oh, well, I've eaten a lot of strange food, like alligator tail. I eat
Hmm.
a lot of different offal, um, at crickets. So I don't know. To me, it's like it doesn't seem that strange, but then I'm like, it might be really strange to people. I mean, people thought it was strange that my child, when we were living in France, he couldn't get enough escargot and frog legs, like ridiculous amounts.
Wow.
And I'm like, because we've just always eaten everything. He keeps telling me like he wants to eat brain, and I'm like, yeah, but there's like these diseases that affect brains. Mom's a little bit like terrified of that. And he's like, take me to a country where they eat brains. Mom, I want to try it. I'm like, oh, he heard some podcast where they were eating brains. So
That's so funny. Well, Dr. Jolene Brighten, I want to acknowledge you for the work that you're doing. You are a pioneer. You're doing amazing work. You're empowering so many women and so many human beings out there. And I share a lot of your information, your research with my community. So your fingerprints are all over the people I'm helping here in Keto Camp. I want to thank you for spending part of your day with me. And where is the best place to check out more of your information?
well, my main hub is drbrighten.com, drbrighten.com. And that's where you'll find tons of resources. Women call it the Google of women's medicine, because just about every question that you could ask, there's an article for that there. And then I'm always playing on Instagram at Dr. Jolene Brighten. And then I have a YouTube channel as well, because I know we all learn differently.
Awesome. Well, we're going to put all the links of those links in the podcast notes here. Again, you were amazing today, and I had a great time with you. And thank you for coming on the show.
Yeah, thanks so much for having me. I appreciate it.